All right. Good evening, good evening, good evening. Oh my gosh, what I went through to try to get on. It's like somebody is trying to keep me from giving this information out tonight. But good evening guys. Keith KL Belvin here. And if you are watching this in replay, make sure that if you comment you put replay so I know that you watched it on replay and I'll definitely respond. Um and this is part 2 of would you send your children to school. Um, I think after reading all the comments, and it was quite a few, and I appreciate everyone who has taken time out. Let me just fix my camera here. There we go. That everyone who's taken the time out to respond to the previous post the other day. I believe that was Saturday that we had the conversation. Let me just turn that down. There we go. And I appreciate everyone that came on. Um, and I said I was going to go over and continue the discussion from the other day. And I wanted to make it earlier because I do have a counseling session this evening. But there's something bothering me. And I believe it's the information that I was able to come across. First and foremost, let me just go over. We were discussing the CDC, the guidelines that the CDC has put out, and they were stating what needs to be in place if you're going to send your kids back to school. Okay, got that. And I walked through each of these the other day. I'm not going to do it again tonight. If you want to go back and watch the video with the same title, you can go back to check that out. But we went through each of the sections, broke each of the sections down as an educator. But I have some other information tonight that may be a little unsettling, maybe not. But and I'm going to put up actually, maybe I can do it now. Let me see if I can if I can put a picture up. I don't think I can. When I put the comment up, I don't think I can get a picture up. No, I'll have to wait, and I'll put it up after I'm done. But guys, I really want to bring to your attention that there is a disease, and I mentioned it briefly the other night, and I said that one of the things that we don't know enough about this virus, we aren't testing enough to know who's had it, who hasn't had it, and folks are making decisions based on the information that they get. Okay, well, because I'm a former health teacher, I look at information a little bit different than everybody else, and I go to different places to get information. I don't just get it from the news. I go to different outlets, but I also, when I look at how they put it and how they word it, I look for progressions. And what I mean by that, and I'll give you an insight to how I look at stuff that's reported. I try not to just get it all from the news, but the news can be very telling in how you can cut through some of the lies, and then you have to pay attention to how certain things move. And I'll give you an example. With a virus cannot move on its own. A virus, and I think we've learned that now with the coronavirus, is that we know that it needs a host to move from one place to another. It has no legs. It has no means of transportation other than from a host to the next host in various forms. Okay. With that said, we know that touching and breathing and things like that, touching clothing that somebody made a touch, touching surfaces, hand to hand touching, as well as droplets in the air, which I think it's airborne to a degree, but I don't have substantial proof to that. But I think the rate of infection supports my opinion. Okay, but here's the thing: any virus that enters the body in any form or fashion can mutate once it's inside the body. That mutation can have many different properties or total different properties, but it'll still be connected to the same virus that the original. And in each person, you don't know what that's going to be. So up until this point, if you notice, the information has changed. And that's how you have to pay attention to how medical places give out information, how the news get out information. So remember, it was, we believe that it's going to affect mostly older people. Then we saw that it changed, and it was attacking folks with diabetes and other previous conditions, as well as old people. Then it was, you don't really have to wear a mask. It's a good idea to now some states like Delaware, you must wear a mask. So you see that there's been a progression, and that's what I mean by paying attention to the progression. So just like paying attention to the progression on the information, well, this virus, if it changes, then they have to try to figure out how to deal with that and still give out the information, because you want to protect the people who now may be at risk for dealing with this virus. Okay, so with that said, what I found in my research is that I already knew that there were children that had been infected with what looks like a Kawasaki disease, which is an offshoot of when they tested the kids from it. They saw that some of these children had been exposed to corona. But we know, or so we think, we know that children aren't as apt to coming down with corona as adults. God bless. And this is why our children have not been in the state that the adults have been. But in doing some research for tonight, I went to a couple different sites: the CDC, the Euronews, um, Discovery's Children's Hospital, and I think that's Boston. I believe Discovery Children's Hospital is in Boston. So I went to like 3 different places just to kind of look at some of the things that we're saying, and I'm going to go through each of those things because I want to be mindful of people's time. And for whatever reason, if there's anybody watching, I don't see a listing here, so, and I can't see all the comments. So if you are, just put a 1 up in the chat, and if I miss anybody's comments, I will make sure I go back and read through. I'm not sure what we have going on here. I know the other night, okay, and I know my computer's been acting up too. So if you are watching, stay with me, because I am in the process of changing up the system here, because I definitely want to get something different. So I cannot see who is in and not in. So we're going to definitely update that as well with everything that's going on. So, okay, so I want to make sure, and I hate that I cannot see. All right, I'll take care of that. I got some information on how to take care of that. So the three, and I'm actually gonna, once I log out, I have, I'll upload the information. Hey, there's a 1. Okay, so I do have people listen. See, I couldn't even see that. Thank you, Madeline. How are you doing this evening? It's always better if I know that there's somebody there, because I'm not sure what's going on with Facebook tonight, because I could see everybody the other night, and all of a sudden tonight I can't see anybody. So if you're listening, put a 1 up, and I'll try to respond and try to get back to you, because I'm not sure what's going on tonight. But I definitely want folks to have this information. But I would prefer to have a dialogue with the folks that's coming in. So, Madeline, I think you were Colorado, right? I think you were from Colorado when we talked. Got you, got you, got you, got you. I remember you saying it was Colorado. I want to make sure I got that right. And so I know we had Colorado, we had Georgia, North Carolina, Philadelphia. I know we had Pennsylvania, Philadelphia, Freeport, New York. I know we had Brooklyn. I know we had a few places in the other night. So, hey, Kim, how we doing? Good evening. Okay, now I'm starting to see some of the folks here. Thank you. I guess, okay, there we go. And how we doing, Kim? And Kim, where were you from, Kim? I don't think I got where you were from when we talked the other day when you came in. I didn't get a chance to ask you where you were from, because I really want to make sure everybody gets this information. And I am going to put it back. I made sure, because I made my own cheat sheet tonight with the links. So I'm going to put it up, so you'll be able to copy the links, or at least be able to, you can go get the information for yourself and read the whole thing, because there's a lot more. I didn't copy everything down. I just took down some notes for myself right here for guys. But I think it's very, very important on the heels of what we were talking about the other night. And if you're going to send your children to school, I believe it is imperative as an educator that I try to give as much information as I can. And so, Kim and Madeline, I definitely, Madeline, thank you for being here. Okay, so I just want to skip down to the bottom, and I made a note and I highlighted this for myself, right? April 29th to May 3rd. There were fifth. Okay, let me back up. Let me do it this way. Okay, I want to make sure I get the name. Okay, the name of this is a multi-system inflammatory disease in children with COVID-19. But not every child that has this disease is testing positive for COVID antibodies or with COVID at the time. So they're not exactly sure. That signals to me that we may have a mutation here, and I'm praying that that's not the truth. But I'm going to just read through some of the stuff that I took from the various sites. And then when you go back to do your research, hopefully I'll give you a jumping off point to be able to do your research, because the numbers in children are increasing the way the numbers were increasing with adults with COVID. That's what caught my attention. Progression. And I always pay attention to progression. I don't worry about the banter back and forth. What I look for is, if you tell me on Monday one person, and then you tell me on Wednesday three people, and most of the time it doubles, meaning it goes from 1 to 2 to 4 to 8 to 16 to 32 to 64 over a particular period of time. So if you look at progression, progression normally tips his hand to how bad something really is. And if you notice, that's why everybody kept saying we got to flatten the curve, and that means to stop the continue rising. And here we are at 100,000 in 3 months. So they say, because that's who we know about. The number normally is higher because there's people that we don't know about. But I got this one from www.cdc.gov, coronavirus 2019, that talked about COVID-19 in children. So I got this one from the CDC website. The CDC recommends that everyone 2 years and older wear a cloth face covering that covers their nose and mouth when they are out in the community. Cloth face covering should not be put on babies or children younger than 2 because of the danger of suffocation. Children younger than 2 of age are listed as exceptions, as well as anyone who has trouble breathing or is unconscious, incapacitated, otherwise unable to remove the face covering without assistance. Wearing cloth face coverings is a public health measure people should take to reduce the spread of COVID-19 in addition and not instead of social distancing, meaning that you should do both. Frequent hand washing and any other preventive actions. A cloth face covering is not intended to protect the wearer, but may prevent the spread of the virus from the wearer to others. This would be especially important if someone is infected but may not have symptoms. Medical face masks and N95 respirators are still reserved for healthcare personnel and other first responders, as recommended by the current CDC guidance. Now, the reason why I copied that down was because I had a conversation with somebody earlier, and it was actually a client, and she was telling me how the number of children that she sees without a mask. And she was like, but their parents are wearing masks. How come the children are not wearing masks? And I said, for whatever reason, people are believing that their children are immune or they cannot get this virus because children are not getting sick. And what I believe is that they are not telling people that children are getting sick because they already know that would strike fear and panic, and they would lose what little bit of control that they have, as well as people would just automatically not want to be bothered with anything. And it's very important to pay attention to, because again, I had already been following these cases of these children getting different diseases, but it's not just here in the United States, it's in other parts of the world too. And that's another thing, guys. Make sure you get in the habit of listening to the news and information from other parts of the world. Malcolm X once said, get your news from different places. Kim and Madeline, you with me? Toss a 1 up to let me know that you're with me so far. And anybody else, if you're in there, if you joined us in the chat room, please toss up a 1. Let me know that you're here, because the way my computer or the way Facebook has been acting up, I want to make sure that folks can hear me and they rocking out with me. I don't want to sit here and monologue. I want to make sure that I can get you guys all the information that you need. So throw up a 1. Let me know that you can hear me, that you're following along with me so far. And I'm pretty sure we'll get a couple other people popped in. And again, I can't see everybody, and I've always had that issue with my phone. I normally don't have it on the computer, but either way. And if you're watching this on replay, make sure that you put replay next to your post or when you come in, so I know that you're watching a replay. So yeah, Malcolm X talked about get your news from multiple different places so you can get it from multiple perspectives, because he always felt that the United States was going to skew the information to make them look a certain way, which we now know that to be the truth. So I've always made it a habit to peek at different parts of the world to see what's going on. Hey, Crystal, what's going on, love? There we go. And I always make it a habit to pick, and I did it when I was teaching. I would always peek because I had kids from multiple countries too, in my classroom. So I always wanted to take a look and see what's going on in Africa and in Asia and in other parts of the world. Okay, so this one comes from the Euro News, www.euronews, and it talks about what Kawasaki disease that is possibly linked with COVID-19 in children. And again, I will post this in the chat when I'm done, so you'll be able to see the information that I'm reading from, as well as the links will be there, and you can go get the links. And if you reach out to me privately in my inbox, I can send you a PDF copy for yourself if you want to have it for your records. Hey, Crystal, how are you doing tonight, Crystal? How are you, love? I miss you, darling. It's been a long time since I've seen you. I hope everything is well with you. Hope that you're doing great. And thank you for joining me tonight. I appreciate you. Okay, this came from the Euro News, guys. And I'll answer any questions, and we'll definitely, and just jump in. If you have any questions, just post them, and I'll read them if you have any questions, anything like that. Okay, so this comes from the Euro News. What is the link between the new syndrome and COVID-19? In countries with large outbreaks of coronavirus, there has been more reported cases of pediatric shock and Kawasaki disease-like symptoms. Some of these children have tested positive for COVID-19 or coronavirus antibodies, which means they came, yes, thank you, darling, which means they came in contact with the disease at one point or another, so they have the antibodies, but they recovered from it. France Public Health Agency said that they have, yes, we do. We need to catch up. I'm looking forward to that. France Public Health Agency said they have had reports of at least 144 children between the ages of 5 and 20 with an atypical pediatric disease since March 1st. Initial hypotheses are that this syndrome may be related to COVID-19 based on the initial laboratory testing, the WHO, World Health Organization, said on May 15th. That's 144 in France. Keep these numbers in mind, and if you have a pen or something like that, jot that down. Somebody put 144 in the chat just so we have it there, so we can put a pin on that. 144 as of May 15th, and that's France. Okay? Now, again, what I try to do in looking at information from other places, now let me go back to something. It said countries with large outbreaks of corona. Nobody has more corona outbreaks than we. We are over 1.6 million. We have more than the next 5 countries combined. Now keep that in mind. The next 5 countries, we have more cases combined to the next 5 countries because we didn't shut our doors and we didn't push people into homes at the beginning because, again, we knew what was going on back in January, February, and March when the president was actually talking about it was a hoax. And now, okay, got what you. I appreciate it, Kim. Thank you so much for coming by. Make sure that you like and share this with people in your circle so they might check it out if they have any questions. I look forward to it. And I'm here because I'm going to reach out. So thank you so much for coming by tonight. So it's very important because now you're seeing that something is reacting in the children differently. And again, when I tell you to pay attention to progressions, it goes back to what we were talking about the other day with would you send your kids to school? I've already said an emphatic no. Because now you have something new on the horizon that they're not talking about it. And I honestly believe they're not talking about it because they don't want people to be terrified and they want to try to get this economy started because they're worried about a depression where they're just not prepared for it. You're not sacrificing children. I believe you shouldn't sacrifice children for that. Some people believe you should. Look at their actions. So again, I'm going to read the last one. And this one comes from the Discoveries Children's Hospital. I believe it's in Boston. But I want you to I believe it's in Boston. No, I think it's in the UK. Or it's in Boston, but it talks about what's been cited from around the world. I'll read it to you. On April 27th, an alert circulated from the UK about a multi-system inflammatory disease in children with COVID-19 based on a small rise in the number of critically ill children with this illness in England, picked up by multiple media outlets. The alert cited features of toxic shock syndrome and incomplete Kawasaki disease, with some children experiencing gastrointestinal symptoms and cardiac inflammation. The New York City Health Department soon followed with its own alert. Now, I went and I clicked on the link for that alert. And again, I'll have the link to where I read this from. I went to the New York City alert, and the alert as of April 29th and May 3rd, April 29th to May 3rd, had 15 children infected. 15 children infected. April 9th, May 3rd, New York City, 15 children. Okay? Now, I started doing some more research. May 22nd, right? By May 22nd, New York City, 161 children, 15 deaths. And 15 states have reported cases of this inflammatory disease with children. That is how the coronavirus started in March. 1 week it was, as we see here, 15. And then within 19 days, 161. Do the math. 15 to 30, 30 to 60, 60 to 90, 90 to 120, and we're on our way to 240. It doubles. When a new virus is unleashed, it normally moves at a rate of doubling. And this is what you're starting to see. But now these are children. And I'm sorry if I'm scaring anybody with this information. You can go search it for yourself. But I got a child to protect, as many of you do. What's your thoughts and concerns, Crystal, Madeline, and anybody else that's listening? If I can't see you, what do you think about that information? Because it shook me up a little bit. I was getting some information just to talk about if we were going to send our kids back to school. And I had mentioned this the other day, but I didn't know it was this deep. And I didn't know these numbers. I knew it was like 100 something because I knew it was 85. The last information that I had was 85 in New York, 15 in New Jersey, and I didn't know about the 10 or 15 in Connecticut. And I didn't know the total now is up to 161, and that's just New York, with 15 states reporting similar situation with children. And we have to arm ourselves, and we already know that in communities of color, there is no reference being paid to our children. And we also got to remember that at the border, there's children of color, brown children, still in cages. And it bothers me when I hear people act like this doesn't matter. I want to go to the beach. This doesn't matter. I want to go outside. And I get it. But what do we do when we see a progression like this? What do you guys think? And anybody that's watching this on replay, if you've gotten to this point, tell me. Write in. What do you think? I'll be coming back and checking all the responses, and I'll respond to them. Because I think we reached a point where we really have to, and you hear me say we can fix this all the time, because we got to protect ourselves now, because information is just not being given to us. Information is being withheld. And I don't know how anybody else feels about that, but it bothers me. What do you guys think? So the thing is, and like I said, I will put up the sheet that I have here and just some of my notes. I will, I made a JPEG, and I'll post the JPEG up in the chat and in the chat stream. And here's the thing: if anybody's watching, if you need to talk to me privately, if you're unsure and not sure what to do, or even just how to start your research, set up a call with me. The initial call is free, and if you want to set up some ongoing services with me, I'm here. I have a session tonight with the young lady at 8 o'clock, and so I'm here, and this is what I do. Because I'm not sending my child or anybody else's child back into anybody's school until you can assure me that my child and anybody else's child is safe. Definitely at a point where I just want to to be on go. However, the pain outweighs the pain. You still have to be still. Yeah, yeah, it does. It does, Crystal. And I think the hardest part with this, we didn't have a chance to prepare. Um, Thank you, Lucky. Hey, what's going on, Lucky? Thank you so much. I appreciate you for letting me know that, Lucky. And Crystal, back to you. I think the hardest thing is that we weren't able to prepare for this sheltering in, and we've been kind of on our heels since, and then all of a sudden now getting into the third month, we're getting going on 12 weeks for some. I know it's coming up on like 10 weeks. I think this Sunday made 10 weeks for me, or yeah, 10 weeks that I've been in. So let's see, early March. Yeah, 10 weeks or something like that. And it's tough. But if the alternative is death, is it really worth the things that we're fighting to get back to? That's just my opinion. You guys tell me what you think. And Lucky, I definitely appreciate you, Lucky. And I don't know what point you came in, Lucky, if you've been here the whole time, because again, I can't see everything. But guys, this is the children now. These are the ones that everybody said we don't have to worry about because our children are not being sick by this. And here's France, other parts of England, New York. These are major cities with major rates of infections, and now we have children sick and possibly dying. Why is this not being discussed? And it scares me because again, that's what you tell me. But I know as a man with melanin in his skin that I know my people aren't cared for properly. So how many of our children? Yes, and let me tell you about the virus from Italy. I have a friend in Italy that I speak to directly, Lucky. He actually is what helped get me and Tiff out ahead and while we were super prepared for the virus here in the United States. My partner, Brian Groves, shout out to Brian. Him and I, we talk every 4 to 5 weeks. And he was telling me, he's a university professor, and he was saying that there was rumor that they were going to lock Italy down. He was like, he wasn't sure. They had shut the universities down. They had shut the schools down. And this was a couple weeks before it really hit big here in the United States. It was just kind of in different places. And he said to me, Keith, he's a little nervous because he was like, all they were letting them do is to come out to go shopping and to take their trash out. But they were confined. And then the next thing he know, they confined the whole country, 61 million people. They put the whole country on lockdown. And he started saying that the hospitals were filling up and that they were making life and death decisions. And he's like, he's just doing the best he can to keep him and his partner alive, his lady alive. And, he works from home, so he was in a good place. And then when they locked down Italy, Tiff and I knew right then and there, there's going to be a problem here in the States. So we went out, we got all the things that we needed, wipes and hand sanitizer, toilet paper, paper towels. We made sure we had all our groceries and stuff like that because we knew that this was going to be a problem. So now, boom, it hits and folks is out here scrambling and everything. And this is bad, but this right here is the babies. And as I just said to you earlier, I pay attention to the progression. And I've noticed that the people that I've counseled with, their hardest thing is trying to figure out what their next move is going to be. Now, some are barely working and some are not. And when I set up my counseling, I try to take that into consideration to try to work with folks because I know money is tight. But I really just want to help people because this is scary. Because when you see the CDC says kids 2 years and older, put a 1 in the chat if you've seen parents walking around with the mask on, but their children with no mask on. Let me know if you've seen that, because I see it often. Put a 1 in the chat room if you've seen that, where you've seen the parent with the mask on, but you don't see the children with a mask on. Or you see the parent with gloves on, and you don't see the child with gloves on, and you see them out in the community. Because I see it often. And it bothers me something awful. Because I knew I knew the CDC had mentioned it, but then I said, let me go back and read so I know exactly what the CDC says. And Thank you. I knew I wasn't the only one. Thank you, Crystal. Um, and it's scary because again, it's like anytime you see certain signs or you see certain things posted, it means somebody had to go through it. So when the CDC says baby, yeah, babies also. But see, here's the thing for me, and I know there's a risk of suffocation, but I'm not gonna leave my 2-year-old. I'm gonna keep an eye on him or her, but I'm covering up their face. I'm not taking that chance. I'm gonna make sure the mask is not will not get trapped around their neck. But here's the best thing: don't take them out. Now, if you got to go to the doctor, I got you. You wrap that baby up. You keep that baby covered. If you got to take them to get treated, wrap that baby up. But if you don't have to go, stay in. I said to a friend from Detroit that this comes down to want versus need. And if I'm wrong, you guys tell me. Many of us are mad because we can't do what we want when we actually don't need some of the things that we're fighting to be able to do. It's what we want to do. Now, some of us, like my wife, has to go out. She's on vacation now. She has to go out as an essential employee. She has no choice. She has to go. And a lot of other people have to go. The young lady I'm speaking to later on tonight, she has to go to work. So she's an essential employee, like my wife, essential employee. They have to go. But a lot of other people that I hear complaining and other stuff is, I don't get to do what I want. And that bothers me. Thank you. Keep them babies at home. Thank you, Crystal. Very true. And anybody else, feel free. If you got something that you want to offer, by all means. And Crystal, you're 100% right. Keep those babies home. Listen, I'm home with KL all day. I am home. I am a house husband. I am home with her all day till Tiff come in, and I do my counseling pretty much in the evening. Every now and then, if I got to do a daytime session, I tell KL, I need you to sit in the living room, just be quiet. Daddy got to talk for an hour. And I need you to hang out, and I'll get her some lunch and let her hang out. And she's quite intelligent, so she gets it. I make sure she does her work first. People do need contact, but at what cost, honey? And thank you for popping in tonight. People need contact. I don't disagree, but at what cost? And if the contact is going to cost you death, yes, contact is, but it doesn't have to be physical contact. You need physical contact when you're a child. As an adult, you want physical contact because we're having conversation now. We're in contact with each other now because you're not being deprived of physical contact because somebody's not allowing you. You're not having physical contact because it can cost you your life. And you don't have to be completely isolated from people. If you trust the partner or friend or whoever you want to come by your house, and you believe that they've been taking the precautions that you've been taking, yes, you can have contact. The question is at what risk? And when you don't know what someone has been connected to, do you really want to put yourself or your children, if you have children with you, at risk? But that's the thing. Babies need contact. It is actually proven that a child in the first 21 days or, first couple of months, if they are deprived of physical contact, will literally start dying. But once you get of age, and I think this is what we have to consider. And we got to have these conversations because that's what's prompting everybody to be like, I got to get out. Well, you can get out. But strap that mask on. Put those gloves on. You can actually have physical contact if you go out. Because, again, if both of y'all are safe and the group of y'all are safe, y'all can sit down and actually go out and jog, and you can go out and hang out. You just can't do all of the things that you do. So the people who have to go to work every day don't have to. Yes, they do. They have the same risk, and this is why the numbers are over 100,000 people dying. Yes. Not they get human. Not necessarily. Depends on your job. I got a nurse that I'm counseling with at 8 o'clock. She has to make sure. This is why everybody is fighting for PPEs, because some nurses are forced to have to rewash and redo some things. The human contact is not, and you'd have to define what you're saying in terms of human contact. There's casual contact, which may have to happen at work. But like my wife, she has to go out to work, but she's not in human contact with anybody because she's in her section of her office and other people in their section, and they don't have contact with each other because that they have to stay sick. That's what the social distancing is about. Well, no, you don't get, well, see, that's the thing. You can if you want to, but the question is, do you want to take the risk? See, it comes down to, again, want and need. If somebody has to go to work, then they have no choice. So they need to go to work. But if somebody just wants human contact for the sake of wanting it, well, then they have to decide if the risk is worth it. I would say no. And that's the choice that every adult has to make. And just like you, when I listen to folks go, I'm not wearing no mask. Do you understand that there's nurses, firefighters, policemen, and other folks who have no choice and have to wear that? Some nurses are wearing it 8, 10 hours a day, and they only get to switch it out once or twice if they can, fully covered, and still got to worry about getting infected. And as we just seen with the doctor who could have retired, came out of retirement, and now he's dead. And now his family's at a loss because he wanted to help out. And I'm sure as a doctor, he took the precautions. Well, I hope he did, but now he's dead. And we see a lot of folks who are involved, and because we don't have adequate testing, we don't know who has it and doesn't have it. So if you can't give me all the things that I need to be safe, I'm going to keep my distance. And that's something that my wife and I talk about on a regular. We know that every time she goes out, she could be bringing that back home. So she takes her clothes off at the mud room in the back of the house, throws those clothes in the wash. We spray down everything with Lysol. She goes and takes a shower as soon as she comes in. We clean that area that she comes in, wipe those areas down, and then we go from there. We clean the stuff that comes in when we have stuff delivered to the house, and we take care of all the precautions that we can inside our home. But I can't control what goes on outside, so I don't go out there unless I have to. And does it mean I got to give some things up? Yes. But my family's safe. And that's the sacrifice that I make. But I don't ask anybody else. And as we went over the other day when we were talking about would you send your kids back to school, I went over the CDC guidelines that they have for principals. And you can watch the other video for that. We talked about it. And even the way they wrote the guidelines, it's not going to protect every child. And they're willing to take risks with other people's children. So tonight, the one that I'm reading from tonight of the information, this inflammatory disease, and let me tell you something, this is just a starting point, guys. If you do some research and you do some Google searching and you read more, you're going to see how this virus that these children are getting, it's brutal. It is brutal. And they're not sure if it's connected directly to corona. But it is definitely the kids are turning up to have had the antibodies, which means they were exposed to corona, got past it, but now it created some other problem with them. And I think we got to pay attention to that. And as a health teacher, former health teacher, I have to be able to try to give that information out to people. Hey, what's up, Jose? Happy Memorial Day to you, my brother, if we can actually say such thing. But, we're here. And my prayers go out to all those who are no longer here. Good to see you, Jose. Great to have you here, boss. But I'm definitely going to, when I get off, like I said, I will post up the information that I read tonight with the links. I will post up in the chat room. And like I said, if you're interested in getting the PDF, which I think will make it easier for you to cut and paste the websites, you can do it that way. I'm not sure if you'll be able to copy and paste them from the JPEG, from the picture. We'll see. But I'm gonna go back and post them up, and I'm gonna post the links in the group too. Also, if you go back into the other live from the other day, part 1 of this, there's links there that I put tonight. There's links to a couple of videos and a couple other things that you can look at that will give you some information to help you start with your search. And honey, how are you doing otherwise though? How's everything? How you been? Because I know you had your page hacked and everything, and I know you had to go through all that foolishness, but how are you otherwise though? Because that's my other thing too, guys, is making sure folks are mentally okay. And that's why I offer the counseling, and that's why I'm here to try to help people. And that's another thing too, guys. Don't be scared to say you need therapy. The initial call with me is free. And I do that free call so we can sit down and try to figure out what is it that you need. So don't hesitate to reach out to me to set up a free call with me, and then we'll figure it out from there. And even if money is an issue right now, then we'll put something on hold and we'll figure something out, because if you need help, you need help. Reach out. Don't struggle alone. Just because we got to be in the house, don't mean that you have to struggle. I just had a call last night with some of the guys I went to college with, and one of the things one of my partners said is that he looks forward to the Sunday calls because it just gives him a chance to help his mind, get his mind right, to make sure he's good, his wife is good, and that made me feel pretty good that the fellas are enjoying the once a week check-in that we do. We use the Facebook rooms. It was actually pretty cool. It went real smooth, and so I would say to anybody, now's a good time to reach out to a lot of the people in your circle. Like you said, honey, people need contact, and we can't give it physically. Let's reach out so visually, and you can hear from them and see them, and then hopefully, as things calm down, we'll literally be able to get physical. And I know it's tough. Like, one of my wife's friends is pregnant right now, and she's terrified that she can't have all the people around her to have a baby shower and to be there as she is moving towards going to have her baby. And I feel for any woman that's pregnant right now during this era, like, what is she going to do? And I'm praying for all of them. I don't want to see anything happen to anybody. So I know it's very difficult. And I'm trying to offer what I can to help people really, really understand that there's somebody here who's willing to listen and to offer what help I can. This is why I discount my books to get them out there and to get people help, because I've already dealt with somebody who said they were going to commit suicide because of where things were with them. And I'm like, thank God they didn't. So how else is everybody else doing tonight? Give me a 1 if you're still with me, guys. Give me a 1 if you didn't fold up and run off. Give me a 1 to let me know. Give me a 1 in the chat room to know you guys are still there, because I can't see everyone that's on. And shout out to Glenn P. Brooks. He gave me some information. I'm going to change that going forward too. So when I do my lives, I'll be able to see everybody. So if you can see me, make sure that you throw a 1 up. And if you're watching this on replay, make sure that you put replay on so I can see you. So school is not going to happen for my daughter right now. We'll see how things. Yeah, I'm getting ready. Okay, got you. Thank you, Crystal. I was getting ready to check and see how everybody's doing. I didn't want to hold everybody up. I want to be mindful of everybody's time. But again, it's just the idea is I'm here to help. So if you can reach out to my inbox here, or you can go, if you want to set up a free call with me, go to bit.ly/Coach Keith. Actually, I'm going to put it in the chat. That I can put in the chat. I can't put the picture up, but I'll put the picture up later. But I'll put my link up to where if you need to reach me, and that's another thing I got to get is a new computer. That's my next move, is to update my computer. Okay, there we go. Coach Keith. There we go. So that's the link right there. Yeah, that's it. Then you click the link if you want to set up a free call with me so I can get your information. But I'm gonna do whatever I can to help as many people as I can. And like I said, I got a call tonight with the young lady who is doing tremendously, but she's a nurse and she's struggling. And then I think Tiff's friend works at Brookdale, and I know she was struggling with what she was seeing. She was just talking about the number of bodies that she's seen, and it was making her uncomfortable. So I told her, reach out if she needs to talk. And I really feel for the essential employees who have to be right there with people in the hospitals and other places and the nursing homes. It's tough. But this right here with the children, whoo. So I just want you to pay attention to it. Let me see if I can steal some of the links from the other one, and I'll bring a couple of those links over. I was thinking about creating a webinar or some way of being able to teach the movie Outbreak. I taught it in class years ago, and I was thinking about doing a class for parents to be able to use the movie Outbreak to teach their kids some things about the coronavirus in terms of transmission and other things like that. I was thinking about it, but I'm not sure. I put a little impromptu poll up to see what folks was thinking. or how folks felt about it. Okay, here's one. I'll put this one up. I think I can cut and paste that. There we go. This is one that'll give you, I think, where is this one from? This is I think this is from one of the New York sites here. I'll give you this one, guys. I think I can share it. I'm trying to, because I want to be mindful of your time. There we go. And I think this is healthmatters.nyp.org, and this is about the children. And let me see if there's another one I can put up for you, and that'll give you some starting points with your search, because you don't have to believe me, guys. Just do the research for yourself. I'm just trying to be a conduit. I'm just trying to be someone who can give you information that you can use, that's going to help you if you have children, if you have grandchildren, or whatever, because it's tough out here. And I want to make sure, okay, there's another one. Okay, up to 147 kids. There we go. That's the NBC link. That'll have the video on it. Okay, let me do it this way. That will have the video. And that was from the New York City News. I think that was the news, or I think that was, we'll see. Yeah, I think those two. There we go. For my guys in New York. And then I know, Madeline, you were in Colorado, so you can actually take a look. I have to get a list of the 15 states, but that you can do a search for. Just put 15 states dealing with inflammatory disease, multi-system inflammatory disease. That's what it's called, multi-system inflammatory disease in children. And I know they said it was 15 states. So, guys, you have any questions? You know, again, I want to be respectful of everybody's time. Shout out to Honey. Shout out to Jose. Shout out to Crystal. Shout out to Madeline. Shout out to Kim. Shout out to, I think I'm missing somebody. Shout out to Kim. I got Kim. Madeline. There we go. And anybody else, if I can't see you, shout out to Lucky. I knew there was one more. Shout out to Lucky. And I appreciate you guys coming in. Always appreciate the conversation. So I'm going to hang out for just a little bit because, again, I want to be respectful of everybody's time. Is there any questions that anyone has? If there's any questions that I can answer for you or anything like that, or if anybody needs to set something up, there's my link. I put it in bit.ly/Coach Keith. Or if you want to send me a direct email, all right, Mr. Keith Belvin @gmail.com, all right? And of course, all my books are on my website, bravenpublishing.com. You can always go there to get my books. But I'm going to be on 2 to 3 times, 4 times a week, just trying to bring information. And I think we're going to, I'm not sure, I'm thinking about doing a part 3 with the schools, or I might do something else. I think I'm going to do the mental health part. But Honey got me thinking tonight, like, how do we do with the personal contact? So, Honey, I may do something about that. You just gave me something to think about. So shout out to you, Honey. And Honey is one of my former students who was pretty good in the classroom. She did her thing then. So shout out to her. Shout out to all my former students. I'm just happy to have y'all around doing your things, man. I think a lot of my former students are doing big things, and I'm happy about it. I'm happy that I'm around to see them all. They're all grown up, and I'm proud of all of you. I really am. I'm really proud of all of you because there's a lot of us that aren't here, older and young. So shout out to everyone. But again, if there's no questions, before I go, give me one last one to let me know if this was content that you could use and content that you liked. And I will definitely try to get more of it. And like I said, I will try to be on, no, not try, I will be on 2 to 3 to 4 times a week. I'll make sure I have subject matter that connects to all of you. And, you know, actually, here, I got a question for anybody watching. Do you prefer this time or later? Like, I came on 9:30, I think it was Saturday or Friday. I think it was Saturday or Friday, I'm not sure. Let me know what time works for you. Are you guys night owls? Do you like this time here between like 6 and 8? Or do you like it later, like 9:30, after you have a chance to put the kids to bed and grab yourself some wine, whatever? Which works, this time or later? Because I could do the morning too, but I know a lot of people at work. Because like I said, I'm home with my daughter, so I can do that. I do my sessions in the evening, normally between 6 and 8. But The days that I don't have sessions, I can definitely come on. So which works for you guys? Earlier or later? I'm a night owl, so later always works for me. But I know people got to go to work in the morning. And when I say later, I'm talking about like after 8:30, from like 8:30 to 11. You know, what used to be the start of the creep hours. Real creeping doesn't start until after 11:30, but you know, I know a little something about that. You got to read from Gigolo to Jesus. But yeah, if you're watching the replay, let me know. I'm going to get ready to go. I just want to say thank you again to all of you. Thank you for taking the time out. I enjoy the feedback. Again, Jose, Lucky, Honey, Kim, Madeline, Crystal. I appreciate you all. And I definitely look forward to answering any questions. I will be coming back to the chat and just looking to see if there's anybody I missed or anything that's typed in that I missed. I will respond to everybody and I will be posting up the links that I gave you tonight so you can have them for yourself, because there's a lot more information on each of those pages that I think you can use. Okay? All right, guys, I'm going to get ready to go. Thank you so much. I appreciate you. Have a wonderful night. Any questions, just keep putting them in the chat. I'll come back and check them out. All right, guys. Have a good one. It's a pleasure. Remember, we can fix this. That's my hashtag, but it's how I feel. Hashtag we can fix this, because we can. If we come together, just like Honey gave me something to talk about, we were able to have a conversation. Jose always brings something to the table for me. Lucky let me know he was listening. Crystal brought something to the table. Madeline brought something to the table. Kim brought something to the table. You guys help me, and then in helping you, we can help other people. So we can fix whatever we're dealing with by starting with good communication with each other. That's what I'm trying to bring to the table. So again, remember, hashtag we can fix this. Take it easy, guys. God bless.